Hello everyone. Today I'll be speaking to you about facts and myths of prostate cancer. The first question in everyone's mind is prostate cancer is seen only in elderly age group. But the fact is this is not true. Prostate cancers can be seen as early as 40 years, even in younger age groups, some different types of prostate cancer. But usually, most commonly, it is seen in elderly age group above the age of 50 to 55 years. In younger age group, the typical prostate cancer, what we call as adenocarcinoma, is usually seen in patients who have family history or a Afro-American races. The second question or the myth which is commonly seen in the general public is whether a person, if he is having raised PSA, is he having prostate cancer? This again is not true. Prostate specific antigen, what we call as PSA, is prostate specific, not a cancer specific antigen. So it can be reached in variety of clinical condition, right from infection, retention of urine, any manipulation like surgical manipulation or catheterization, or even if the gland is very much enlarged in benign prostatic hyperplasia. So it's not necessary if a person is having raised PSA that he is going to have prostate cancer as well. The third question which comes in everyone's mind is prostate cancer are usually grows very fast. This again is not true. It all depends what grade the prostate cancer is, how high the PSA at the time of diagnosis is. Usually most of the prostate cancer are very slow growing tumor, especially when the Gleason grade is less than 7 or the PSA is less than 10. But higher the PSA or higher the grading, they are quite aggressive and can spread very far. So you need to consult your urologist before deciding upon. Fourth question which comes in everyone's mind is if I'm having urinary symptoms, I'll have prostate cancer, especially the elderly. Is not again true. Majority of the urinary symptoms in the elderly male is because of the benign prostatic hyperplasia. Majority of the elderly population can have a large prostate, and of these 85% are due to benign reason. Only 15% can be malignant. But a urologist can only decide by doing a clinical examination, that is digital rectal examination and a PSA test, whether you need further testing or investigation to diagnose prostate cancer. The fifth question which comes in everyone's mind is whether prostate cancer runs in family. Yes, that is true. Prostate cancer can run in family. And if especially the first degree relatives are having prostate cancer, there's high chances of the relative to have prostate cancer. So a early PSA screening is must. As early as 40 years, usually we recommend them to have. If the first PSA is normal, then probably alternate year they can do till the age of 50, and after the age of 50 years they have to do yearly PSA, which is must. The sixth question which comes in everyone's mind is if I have a prostate cancer, then surgery is the only option. That again is not true. There are plenty of options for prostate cancer treatment. It all depends on the stage of the disease at the time of diagnosis and the symptoms of the patient. Well, very early prostate cancer or very low grade prostate cancer can be observed especially in very elderly frail patients. Patients who have localized prostate and fit individual, usually surgery, especially the robotic surgery, is the best treatment. Patients who are having locally advanced disease but non-metastatic one can be treated by either multimodal treatment, which includes surgery, radiotherapy, as well as the hormonal therapy, or they can be treated by radiotherapy and hormonal therapy. Usually, the urologist and medical oncologist or the tumor board decides the best form of treatment for that particular patient. If patient is having metastatic disease, then it depends on the volume of the metastatic disease, and patient will definitely need a hormonal treatment. In addition, they may need some other form of therapy, either a non-steroidal hormonal treatment or chemotherapy, which are the standard treatment for metastatic disease. There is again a myth that if a person indulges in a sexual activity more, there can be increased risk of prostate cancer. Well, on contrary, the other way is true. There are few papers which says that if a person have good number of ejaculation more than 21, the chance of having prostate cancer is less as compared to general population. The myth number 8, what people believe is if a person have undergone a vasectomy, then the chance of prostate cancer is more. Again, this is not true, and a person who is non-vasectomized and person who is vasectomized, probably the incidence of prostate cancer is as good as the general population. The other common myth is if I'm having a benign prostatic hyperplasia, the chances of having prostate cancer is more. Again, this is not true. A person, if he's having a benign prostate cancer, did not have a prostate cancer in future. But many of the patients, usually because of the enlargement of prostate, they come to the clinic with urinary symptoms and then they are diagnosed with prostate cancer. The other myth is PSA should be done only if the patient is symptomatic. Well, now current guidelines, international guidelines, they recommend PSA screening, especially in the high risk cases who is having family history or patient of African-American origins. And other patient, after thorough discussion with your urologist, you can also have PSA screening test, which is a very simple blood test, can be done after understanding what exactly we are doing and its implication. So PSA screening can be done especially in general population after the age of 50 and those who are having family history after the age of 40 to 45 years. Thank you.